Chapter 50 is Diagnostic Imaging. In this lecture, we are going to explain what X-rays are, how they are used for diagnostic and therapeutic purposes. We'll compare invasive and non-invasive diagnostic procedures, carry out medical assistants' role in X-ray and diagnostic testing, discuss common procedures, different types of radiation, radiotherapy, and how they are used. We'll also explain risk and safety precaution associated with radiology work and related uh, this advanced technology in medical imaging and EHR. Let's start with the history first. Wilhelm Röntgen first discovered the technology of X-ray in 1895. The well-known first image of his wife's hand with her wedding ring evident, that even though he meant the purpose to be industrial, the medical world was using this invention 6 months later to locate bullets in fallen soldiers. Newer imaging of ultrasound was slow in following as it first appeared in 1947. More than two more decades passed before the MRI was used in 1974, and it was not until 1980 that physicians tried MRI of the brain. The first diagnostic X-ray machine were introduced in 75. Digital X-rays were introduced in 1997. Today, radiology is widely used as diagnostic and therapeutic tool. The world of imaging has expanded to include ultrasound, mammography, magnetic resonance imaging, and nuclear medicine. One example of diagnostic tool that with this X-ray we can uh, find out the fracture of bones. Cancer treatment, radiotherapy is used. That is a part of therapeutic tool. So two diseases, diagnostic and therapeutic. Now, diagnostic radiology is the X-ray for diagnostic purpose. Contrast medium is a substance that makes the internal organs denser and blocks the passage of X-ray to the photographic film. An invasive test requires a radiologist to insert a catheter, wire, or other testing device into a patient's blood vessel or organ through the skin or a body orifice. All invasive tests require surgical aseptic technique. Patient may need general anesthesia for some procedures, and anesthetist must closely monitor the patient for complications. On the other hand, the non-invasive procedures does not require inserting devices, breaking the skin, or monitoring at the degree needed with invasive procedures. Most familiar equipments used uh, will be conventional X-ray machine over a table. The image produced by the developed on maybe developed on a standard X-ray film or captured digitally. Now, what is the role of a medical assistant? Medical assistant may work with diagnostic radiology in a facility or in a medical office, and the scope of practice in certain states differ as to what is allowed for areas of assistance. In all states, pre-procedure patient care are allowed. Medical assistant may perform tasks involving scheduling and instructing the patient. Proper terminology will be, and non-technical language should be used to explain the procedure to the patient. A medication history will be obtained, and if the patient is a woman of childbearing age, she will be asked about the possibility of pregnancy. During the test, medical assistant can assist radiologic technologist if requested and within a scope of practice. Often, the best help is provided by keeping the patient calm and still. Patient can be assisted after the procedure to return to a private dressing area. Documentation of procedure is also needed for patient's medical record. Managed care health insurance plans often require the use of certain radiology facilities where they have contracted the services. Insurance verification should be a regular step in a pre-procedure care. Many extra facilities are now storing digitally, but it is possible for you to work in an office where actual extra film is produced. In those cases, fresh film should always be kept available. New and exposed film should be maintained at a temperature between 50 to 70 degrees Fahrenheit with a relative humidity between 30 to 50%. Packages should not be stacked on each other because it will cause pressure marks in the film, and these film packages should only be opened in the dark room, not to be stored near acid or ammonia vapor. Now, before we talk about the contrast media in diagnostic test, I would like to share uh, two short videos, like not more than 4 minutes, and that will help you to understand how it looks like to work in a facility that deal with X-ray or imaging. So let's watch this.
The MA part of both is the same, medical assistant. But then the x-ray, then you get to, if someone comes in with a cold or a sore throat, then you get to do, like for a chest x-ray for if they're coughing. Abdomen pain, you get to do an abdomen x-ray. So you do the MA work, but then you also follow through with what else is wrong with them. Come in hurt, spine, wrist, fingers, whatever they need. So it completes the office visit. It's really up to the student and what they want. If they're interested in just medical assistant, like maybe OBGYN or pediatrics, then the regular MA will work. If you want to get into body injuries, any type of internal problems, then the x-ray fits you.
My fascination has always been bones. I love seeing everything about bones. And as far as medical assisting, I just love helping people. So that way, it was kind of fun.
We really strive to give you hands-on experience. And the classes are small enough that you can really get one-on-one training if you need it. We really thrive on book work. Of course, you have to have book work, but also the hands-on is very important. So when you go out there, the doctors and the officers see that not only do you have the intelligence, but you also have the hands-on ability. And that's the fun part. Anybody can sit and teach you out of a book. It's all the hands-on part. And we do have the machines here, so you get really good, accurate hands-on ability.
We do a lot of drawing up of injections. We do a lot of practice with positioning, with the x-ray machines and all of that. It helps us here because we practice as if we are in the real world. So once we go into the real world, it's not so complicated. It's just a smooth sailing process.
Here at Fortis, they call it a BXR, which is a basic X-ray tech. And in that program, you take medical assisting classes, your clinical classes, administrative classes, and then inside of that program, you also take your X-ray classes. With the X-ray certification, you can go into different specialties. Of course, medical assisting is surface level in an ambulatory setting, which would be a doctor's office. But if you have that x-ray, one, financially, you can make more money. And two, it just gives you more to put on your resume to go into the office and do different things. Doctors inside of offices that have these x-ray machines really don't run the machine. We run the machines, the GXMO, the BXR, they run the machine. So it makes you a very big asset for your physician office or, whoever you're employed by.
Our students learn to do x-rays in an office. That is what they are designed to do. In our urgent cares and doctor's offices, when you go to see an orthopedic doctor, they take their x-rays and they do casting. A lot of our students are doing wound care and wound vacs and things like that when they go into the clinical setting. I feel we're all here for the outcome of our students and to make sure that they are well prepared in the career that they have chosen, and not just in the MA or MABXO, but in all the programs that Fortis offers.
Okay, so that video was both are is how and what to do in a short way, brief way. But we'll learn more about these things soon, and I'll share a few more videos later on when we come to those things with DICOM and DEXA and different specialties, they use those things. Okay, so let's go to the contrast media in diagnostic test. This type of media may be used in angiography, arthrography, barium enema, barium swallow, cholangiography, cholecystography, and many of those diagnostic tests. Some of them can be administered by mouth or by needle or by catheter into a blood vessel. It can be also introduced by a route that introduces the medium into an organ or body cavity. Contrast medium can cause adverse effects such as abdominal cramping, constipation, nausea, vomiting, diarrhea, skin rashes, itching, heartburn, dizziness, and headache. These are some examples of contrast medium, like fluoroscopy, hysterosalpingography, angiography. I'll share some pictures later on. Now, let's take a look at this arthrography. Arthro means joint. So arthrography is performed by a radiologist who uses a contrast medium and fluoroscopy to help diagnose abnormalities or injuries in a cartilage, joint, ligament, usually the knee and shoulder joints. Like you see here, this radiologist, he is introducing this medium in the right shoulder joint and can see this picture. This moving joint can be seen because the machine is taking pictures, and that can be very good to find out what is the diagnosis. That in case of barium enema, radiologists will instill barium sulfate, a chemical, through the anus into the rectum and then into the colon to help diagnose and evaluate obstruction, ulcer, polyps, diverticulosis, tumor, or motility problem. This is called lower GI series. GI means gastrointestinal. So lower part of the GI is the area where we can take pictures. A single contrast method uses only the barium, while a double contrast method will have the addition of air added with it or without the barium present. Digestive tract must be completely empty during extensive and uncomfortable preparation by the patient. This is cholangiography. Cholangiography takes picture the gallbladder, and the bile duct. It involves injection of contrast medium directly into the common bile duct, as you see in this area, and which is blocked due to the gallstones. So we can easily diagnose those cases. X-ray, MRI is immediately completed after the injection. Computed tomography, CT scan, or CAT scan. These are done with specialized X-ray camera that rotates completely around the patient, and a computer that compiles one cross-sectional view from each rotation of the camera. Almost all abnormalities in the body, structural abnormalities mainly, are diagnosed by CT scan. Let's talk about IVP, intravenous pyelography. Pyle. Pyle means the renal pelvis, the part of the kidney. And with this imaging technique, we want to see the condition of kidney, ureter, bladder, or urethra. This technique is also called exterior or excretory urography. Excretory urography, and this is what we do. First, we are going to inject the patient with a contrast medium in a vein. A series of X-ray will be taken while the contrast media is traveling through the kidney, ureter, and bladder, and we can identify any abnormalities or trauma to the urinary system. Retrograde pyelography is similar to IVP, except that the doctor injects the contrast medium through the urethral catheter. I mean, going backwards from the urethra to bladder to ureter and kidney. This is retrograde. Retrograde means going backwards. And this is usually done if the patient's kidney function is pretty poor and we cannot do IVP. So this is another way, retrograde pyelography. KUB, kidney, ureter, bladder radiography, also known as flat plate of abdomen. KUB radiography is an X-ray of abdomen used to assess the size, shape, and position of urinary organs, to evaluate urinary system diseases or disorders, and to determine the presence of kidney stones. It also can be helpful in determining the position of an intrauterine device or in locating foreign bodies in the digestive tract. MRI, magnetic resonance imaging. MRI uses a strong magnetic field and radio frequency signals in combination with a computer to image internal structures and soft tissues. No ionizing radiation is used to produce the image, making the risk of harmful effects low for the patient. However, a claustrophobic patient, people, they don't like a small space. These patients may need medication to tolerate the experience of being inside a scanner, which makes a lot of noise during operation. This one is mammography. X-ray examination of internal breast tissues, helpful for diagnosing breast abnormalities. If we find any abnormality in breast, the physician may want to go for biopsy to determine malignancy. That is, whether it is a cancer or not. We can perform stereotactic breast biopsy, which is less painful and less invasive than conventional excisional biopsy. So this would be good to see, good to watch what is a stereotactic breast biopsy. 1 minute video for you.
This is a video of an ultrasound-guided core needle breast biopsy. The lesion is localized using ultrasound. Local anesthesia is injected in the biopsy site. To avoid unnecessary trauma to the skin, a small skin incision is made with a scalpel blade prior to the biopsy. The biopsy needle is inserted into the lesion using ultrasound guidance. Here you can see the lesion, and this is the biopsy needle. When the biopsy gun is fired, the interior shaft of the needle is fired first, immediately followed by the exterior sleeve, 22 millimeters into the tissue. The biopsy material is placed in an indentation in the interior shaft. The material is placed in formalin for pathological analysis.
Okay, so I believe that you just have learned how this selective core biopsy is done in case of breast tumor. Next procedure here is myelography. It's a kind of fluoroscopy of a spinal cord when the MRI is not possible. Think about a patient who is having a pacemaker or other medical device that prevents the patient from undergoing MRI. The physician performs a lumbar puncture, removes some cerebrospinal fluid, and instills a contrast medium to evaluate the spinal abnormalities such as compression of the spinal cord. This is myelography. Nuclear medicine, also known as radionuclide imaging. For common nuclear medicine scan, the technician uses a scanner called a gamma camera, which detects radiation from the radioisotopes and converts it into an image called scintigram or scinti scan. SPECT SPECT is often used to locate and determine the extent of brain damage from a stroke. PET, positron emission tomography, requires the injection of isotopes combined with substances involved in metabolic activities such as glucose. It is especially useful for conditions like epilepsy, mental illness, or Parkinson's disease. To evaluate the condition of heart's myocardium, we use MUGA scan, another name, nuclear ventriculography. And it can be done with the patient is at rest or in stress while exercising. And this involves the injection of radioisotope that concentrate in myocardium. This one is interesting. DEXA or DXA, dual energy X-ray absorptiometry. It is often called the bone densitometry and is a screening test that uses small doses of X-ray to determine mineral density of a person's bone. We want to monitor bone diseases like osteoporosis or other conditions that causes bone loss. We use T-score and Z-score to evaluate the patient's bone. T-score is a measure of amount of bone that person has comparing with that of the young adult. In Z-score, the amount of bone of patient is compared to people of the same race, gender, age, and size. So how is this done? Let's have a look at DEXA.
So a DEXA scanner is basically a large X-ray machine, and it uses X-ray to measure the different component parts of the body. So we use low dose radiation, really low dose radiation, and then from that we can get an accurate assessment of lean tissue, fat mass, and then bone density. So it gives us a really accurate picture of the body. A lot of different people might be interested in that. Anyone looking to gain weight, lose weight, anyone potentially with bone density issues. So a lot of body composition tests just look at the body comp, whereas the DEXA scanner gives us the bone piece, which is very important. We work with our own students to teach them how to do it. We work with our student athletes as well. So we have football, baseball, basketball come in to get scans done. So we have a lot of undergrad students involved in work, and it really does give them that extra little bit when they're applying for PA school, PT school, or even going on to jobs in strength and conditioning, sports performance. They have that extra little bit of experience.
And then also with the DEXA here, you get to learn great patient care skills with taking care of them, learning more about the scan and the diagnostic techniques that go along with the DEXA. We have a lot of great resources. I love all the research opportunities. I feel like that's not something that you see a lot of other places.
It's just such a nice experience for the students that they don't get in a lot of the bigger universities, because you don't have that hands-on experience that we get here.
I've met a lot of great people here, including both faculty, staff, students. Really feels like a family here. I'm going to be sad to leave once I'm done here.
I mean, that's what keeps me here, is the people and the students. That's just the energy from our students, the fun they have in the classroom. We're really lucky that we've got a lot of lab practical work. So just that you can interact a little bit more than standing on top of the classroom, actually get in, get walking around, get talking to them, get to know them. That's what is the great piece of this job, is the students.
So that was a DEXA scan to find density. After completing this diagnostic part, the next part is the treatment. Radiation therapy is used to treat cancer by preventing cellular radiation, cellular reproduction. Teletherapy, also known as external beam radiotherapy, and it is the most common form of radiation therapy done on outpatient basis. It allows deep penetration of tissue and is used primarily for deep tumors. Patient will have minimal side effect, which may include a sunburn effect at the treatment site, mild swelling and tenderness, as well as mild fatigue. In stereotactic teletherapy, which is used for brain tumor as well as liver, prostate, lung tumor, we allow very precise delivery of radiation to the tumor. In brachytherapy, localized cancers are treated with a temporary radioactive implant. This implant will be placed close to the or directly into the cancerous tissues. This technique limits radiation exposure to healthy tissues, targeting only the area where the tumor is located. During brachytherapy, the staff and the patient are subject to radiation exposure, making radiation safety precaution of prime importance. Advances in imaging technology have helped improve the safety of radiologic procedures. The physician must still assess the benefit to risk ratio when recommending a diagnostic radiology procedure. And remember that radiation does have a cumulative effect. Safety precaution for personnel working in a medical facility that performs radiologic tests are very important. Staff should wear a device called dosimeter to measure the degree of radiation uptake to which they have been exposed. Equipment should be maintained and checked regularly for radiation leakage. Technician and other members should wear a garment that contains a lead shield. Electronic health records have advanced technology in healthcare at a rapid pace. Digital radiology devices have been integrated with EHR system to provide quality images and rapid access for physicians who no longer have to wait for film processing and development. I recall that when we were in 1980s and 90s, in those times, we had to wait for hours to get an X-ray done because that went through some process to develop from the X-ray film, the negative film to the positive film, and the chemicals were used. It was really a tough job. But nowadays, things are digital. DICOM is that word. DICOM means digital imaging and communication in medicine, and it is the protocol for handling, storing, printing, and transmitting information in medical imaging. So why is this important? Because it provides better image consistency. Quality is much better with faster results, decreased radiation to patient, easier X-ray file sharing, simple storage, and environmentally safe because it does not require any chemicals to produce this image. The last thing to know is that in advanced radiology, nowadays it is possible for 3D, 4D ultrasound with live action image. We can see the fetal movement, the baby inside mother's uterus. We can see it in the screen. We can study body organs and guide needle biopsies. So the DICOM and the advanced, 3D, 4D ultrasound, both I want to share two videos, last two videos here, and you will know what I mean by those interesting things like DICOM and 4D ultrasound. Let's have a quick look.
There are questions about the new 3D, 4D ultrasounds for expectant moms. They can give you great pictures of your unborn baby. But who should get them? How often? And who should perform them? Tonight we get the fast facts from the pros at Riverside Maternal Fetal Medicine. Kendra Foltz is about to get the best look at her unborn baby.
We want to have fluid here.
At almost 30 weeks pregnant, she's having a 3D, 4D ultrasound done at Riverside Methodist Hospital's Women's Center. And the view that doctors and mom get of this little guy is stunning.
And we can get some really amazing 3D pictures. So from an aesthetic point of view, the pictures can be tremendous.
3D is a detailed look inside the womb using sound beams. 4D is in real time. Dr. Fox performed one on me, and we got to see my baby girl. Can you see her face in there?
Oh, that's nice.
Oh, wow.
I mean, for it being technically hard. Can you see the chin in the mouth?
Yeah. While I was in excellent hands with Dr. Fox, this isn't something to do for non-medical reasons or without talking to your doctor first. Doctors tell us they discourage the use of so-called entertainment imaging or just getting the image because it looks cool. But for doctors, this is a great way to get a look at anything that might be wrong.
The types of abnormalities that we find an advantage with the 3D, 4D tend to be the surface abnormalities, particularly things like abnormalities of the hands, of the feet, perhaps of the face, things like cleft lip.
And for Kendra, it's peace of mind that her son is growing right on track. And they print out the pictures, and I got them home, and I went, I lost it. Yeah. I can't see it in there anymore, the face,
I know, especially those early ones, those first ones. They're really hard to figure out what it is. Looks like a lima bean, at first, but yeah. then it starts to grow.
But it's neat stuff.
Hi, folks. My name is Greg Turner, the radiology coach. My job is to demystify the enigmatic world of X-rays. Digital Imaging and Communications in Medicine, or DICOM, is a standard that was developed in 1985 by the American College of Radiology and the National Electrical Manufacturers Association. It is a language that is responsible for the communications, storage, printing, and transmittal of digital images in radiology. In other words, it's the language of the X-rays. DICOM was formed because of the need to establish an encrypted platform from which all X-ray specialties could rely on when sharing information. There was a need to adopt a uniform language that allowed medical entities to exchange radiologic images between them. DICOM allows hospitals and clinics to safely manage X-ray films while adhering to strict federal guidelines regarding patient information and confidentiality. DICOM is utilized by virtually every medical imaging modality, including general X-ray, ultrasound, CT, MRI, and more. It can be used with printers and interfacing with medical management platforms like electronic medical records and PACS software. Incidentally, it is often integrated with HL7 software for higher functionality within medical facilities. DICOM is simply a format that allows medical personnel to safely manage imaging files. This assures patients that measures have been taken to protect their health data, and it keeps hospitals and clinics accountable to this. Current HIPAA laws mandate that patients' records be protected and shielded at all times. Patients have the right to privacy, and the standard of DICOM is the tool of choice for medical imaging. This sophisticated standard is utilized worldwide and bridges the gaps across many countries by raising the bar for radiology cross-pollination. That concludes this segment on What is DICOM? If you like this presentation, please select the subscribe button below the
Okay, so we have come to end of this chapter. That is the diagnostic imaging. And in this chapter, we have studied X-ray used for diagnostic and therapeutic purpose, invasive versus non-invasive X-rays, our role as a medical assistant to assist radiologist or technician in pre or post procedure care, and then a lot of those words we have found here in this lecture, like angiography, fluoroscopy, MRI, CT scan, IVP, and many more. And at the end, we discussed about DICOM, teletherapy, brachytherapy, and the risk of radiation, how to minimize those things. So that is end of chapter 50.